Hello, my name is Neurological. I'm a student nurse practitioner, and today I'll be doing a neuro exam. I'm going to break this down into two parts. The first part is going to be the cranial nerves and coordination, and the second part is going to be the motor activity and muscle strength. So we're going to start with the cranial nerves. For the first one, we're going to do what we call a smelling test. I want you to close your eyes. I'm going to put a substance near you, and I want you to tell me what you smell, okay? So can you close your eyes? This is for the olfactory. What do you smell?
Coffee.
Okay. How about now?
Mint.
Okay, which is correct. You can open your eyes. I'm gonna start with inspecting the nasal passage. I can visualize inferior turbinates. I don't see any deviation of the septum. No drainage. Second, we're going to go to the optic. We'll do the visual acuity, about 6 feet with the Snellen test. Tell me the smallest line that you can read.
LTFPH.
Okay, can you close one eye and read the smallest print that you can?
LTFPH.
How about with the other eye now?
LTFPH.
Okay, that is a 20/20 vision. Next, we're going to do the visual fields of acuity. You can, okay, give you a few seconds. Just let me know when you see my fingers wiggling, okay?
Yes. Yes. Yes.
Okay, there is no defects. I wouldn't do for nasal fields. And next, I'm gonna look into your eyes. Okay. Got the light on. Okay. So I'm gonna inspect your eyes. Can you close your eyes? I see the eyelids. I don't see any lesions. We can open it. So I'm gonna look at the lacrimal apparatus. No drainage, no lesions. The sclera is white. Okay, I'm gonna inspect your visualize the anterior chamber. Do it on this side as well. Anterior chambers. Okay, now I'm gonna get really close to you because I want to visualize your eyes. Okay. Okay, I can visualize the optic disc, the veins, and the arteries. There is no cyst, no hemorrhage. Look at the other side as well. Open your eyes. Visualize the optic disc, arteries. There is no hemorrhage, no cyst. They appear to be symmetrical. Next, I'm gonna check for direct and consensual reaction. Let's see. Let's see how you're reacting. So the eyes are equal, round, reactive. It's about size 2 on both sides. Now I'm gonna look for consensual reaction. And I can see the other pupil constrict as well. So next we're gonna move from there, we're gonna move on to some other eye exams. We're going to move into cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens. I want you to follow my finger. Okay. I want you to follow. Look at my finger. Follow it. For convergence. All right, now look at my finger. Look at the wall. My finger. Look at the finger. Look at the wall. Okay. Next, we're going to move on to the cranial nerve number 5, which is trigeminal. I want you to, clench your cheeks, your teeth. Look at the temporal muscle. Equal, bilateral the same. Okay, next you can open your eyes. We're going to move on to cranial nerve, the facial nerve, nerve number 7. Can you smile? Frown? Puff your cheeks. Okay, I know he has a toothache, so it's gonna be sensitive on the left side. Okay, next we're gonna move the. Okay, you can relax for a little bit. We're gonna move on to the vestibular cochlear, nerve number 8. Okay, I'm gonna whisper and I want you to tell me what you hear, okay?
21.
Okay.
33.
Okay, good. Now we're gonna move on to nerve number 9, which is, and number 10, which is the pharyngeal, ultrapharyngeal, and the vagus nerve. So I can listen to his voice quality right now. I don't hear nasal sounds. I don't hear any hoarseness. I want you to open your mouth and say ah. Open your mouth, say ah. I'm just gonna look to the palate and the pharynx, which is a normal movement, symmetrical. Next, we're gonna move on to the spinal accessory muscles. Look at your muscles for symmetry. Okay, can you shrug your shoulders? The muscle is symmetrical. And then we're gonna move on to nerve 12, the hypoglossal. I want you to stick your tongue out, stick it out, and move it side to side. I can see equal movement. Stop. The tongue, open your mouth, appears midline, no fascination, no deviation. Next, we're gonna go to the upper extremities, rapid movement, and then point to point. So I want you to, with your finger, touch my finger, your nose. My finger, your nose. My finger, okay? Now with the other one. I notice the right side is a bit slower, which know this patient in his history, it is normal for him. It's a normal finding in a different patient, but this patient has had this since birth. Okay, next I want you with your palms, touch your thighs, and rotate in the back of your hands, as fast as you can. Okay, good. Looking next one. I want you to put your hand, push down, as fast as you can. Just tap, like you're pressing the gas, with both. Like you're pressing the gas. Move up and down, up and down. Yep, up and fast as you can. With both. And again, the right notice, I noticed the right one is having difficulty with, which will be a normal finding, but for this patient it is normal. And then with your left toe, I want you to go across your right, from your knee down, okay? And then with the other side. Okay. We're gonna move up. I want you just have a walk. Looking at his gait, just normal walk. Okay, notice I'm limping on his right side. You can come back. Okay, how about walking on your toes? Notice I'm gonna put you on the right. Okay, how about with the heels? Just on your heels, or you can't. Okay, I noticed that you can't. All right, that will be a normal finding. Next, we're gonna go with the Romberg. So for this test, I want you to put your feet together and close your eyes. In a positive Romberg test, okay, it's okay. The patient will lose balance, kind of shift, and I will be there to support him. And then for the next one, pronator drift, I want you to put your arms up, palms up, and then close your eyes and count to 10. Count to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, we can do it for about 20 or 30 seconds. I don't notice any pronator drift. If it was a pronator drift, you would see, you can open your eyes. One of the arms start to drop. And this concludes, well, this examination.